Hey guys, welcome back to the channel. If you're new here, I'm Dr. Z, a breast specialist, and we're going to talk about something that lots of people have interest in today. 24-hour breast augmentation recovery. Some people call it rapid recovery or next day breast augmentation. All of that just means getting you back to your normal life as fast as possible. So what makes up a 24-hour breast augmentation? Is it real? What are the results really like? And how is it done? Today, we're going to find out. Here we go. So this is actually an update to a video that I made several years ago talking about the rapid recovery breast augmentation method. In that video I described how I was doing it at the time, and I should point out, like I did then, that I didn't invent a rapid recovery method. In fact, one of the pioneers was a doctor named Dr. Tebbets, and it's been improved upon and kind of altered based on the surgeon's preference. But the way that I did it back then, which has been about 7 years compared to now, is mostly unchanged. The majority of the things that I do differently are slightly with technique and then also with the post-operative pain management for the patient. And these things have made a big difference. So this is kind of an update after 7 years experience using rapid recovery. So what is it? Like I said in the introduction, it's an attempt to get a breast augmentation patient back to her normal life as soon as possible with little downtime, little pain, and no need for extensive time off of work and no need for extensive use of medications. The way that it's achieved is two parts. The first part is the surgeon's part, which is what I do during surgery to prevent a lot of collateral damage and a lot of inflammation and unnecessary pain or unnecessary downtime. These include technique measures such as small of an incision as possible without stretching too much. It also includes a very hemostatic technique, which means minimal blood loss and blood in the pocket. Blood is a very potent inflammatory agent, and if you have a little bit left over in the pocket when everything is done, or if it continues to bleed or ooze a little bit after surgery, it's typically not dangerous, although it can induce inflammation, increased irritation of the chest wall, and pain, as well as long-term problems like capsular contracture. So we want a very dry, bloodless field throughout the entire procedure. And I mentioned little collateral damage. That means little disruption to normal anatomical structures that you don't need to mess with. So we don't need to unnecessarily injure bovae, which is cauterize, or dissect parts of the pectoralis major muscle or the serratus or the anterior chest wall if it's not absolutely necessary. And in fact, I try to stay in a very clean, meticulous plane in that loose connective tissue between the chest muscle and the chest wall, which is called a subpectoral plane. Or if it's going to be a subglandular placement of the implant, then we want to use the same type of meticulous technique, but without injuring or damaging the pec major's anterior surface. All these things will cause less pain, quicker recovery, and a much happier patient after surgery. The last thing that I do specifically towards the rapid recovery method is use of topical anesthetic in the pocket. After irrigating everything out with antibiotic solution and ensuring that we have a nice clean pocket to accept the implant, then I will instill about 10 cc's of a long-acting topical anesthetic. Is actually an injectable bupivacaine that is used topically in this case to sort of coat the entire area and help soothe that area and prevent you from experiencing pain when you wake up from surgery. This will continue on so that you very slowly will experience some discomfort, but once you've started moving around and using your pain medicine, which we'll discuss next, it'll be a very smooth transition. The second part of the rapid recovery method is really what we do in the recovery period, and it largely depends on the patient's work at home. So this is going to be physical activity and exercise, breast massage, and anti-inflammatory medication. In the old days, patients would have augmentation done in a hospital. They would stay at least overnight, if not for 2 days. They would be on IV pain medications and narcotics, and they would be bound in the chest, and they would be instructed when they go home to not move and to rest their arms and basically be in bed for a couple of weeks. And of course, that's all drastically changed, and even regular breast augmentation techniques are nothing like that. However, we want to take it a step further with a rapid recovery method, and I'll have you go home after surgery, maybe take a little nap, wake up, shower, and then possibly go out to dinner that night or have dinner at home. But the getting up, showering is important. What that does is it keeps you moving, washing your hair, moving your arms, using that pec muscle, and the warmth from the water on your chest, nice warm water, will help to relax those muscles so that they don't spasm and get tight. And it's like a nice massage, and it'll feel very relaxing overall. We can use shower right away because of the use of skin glue over the incision, so it's waterproof. I don't typically advise getting your incisions wet for about 2 days if you don't have a skin glue such as Dermabond used as the final layer of your closure. So we're going to get home, we're going to take a little nap, and then get up, shower, move your arms around, go out to dinner is great. And the next day, repeat the showers as frequently as you want. Twice a day would be great. Warm showers, steamy conditions are great. And then exercising. Have you moving your arms like this, and then doing your breast exercises, which I discussed in another separate video, which is an integral part of preventing capsular contracture, but also helping you your implants settle and recover quickly. So what we're going to do is massage the breast gently at first, and we give you instructions on how to do that so that you keep the pocket loose and the muscles soft and relaxed, and you get a little bit more aggressive with those massages as the days go by, so that after a couple of weeks you can do it pretty vigorously without any problem. The third component for the patients to do at home is anti-inflammatories. So I used to use narcotics, frequently Percocet, and it's a good analgesic medicine. It controls pain, but it has no use for anti-inflammation. And so what we found is that using high-dose ibuprofen helps tremendously with pain, but it helps tremendously with anti-inflammatory properties that it possesses. And so with ibuprofen, you can avoid narcotic side effects, drowsiness, constipation, stomach ache, nausea. We definitely don't want you to be taking medicines that are going to cause you to throw up and then have a lot of heaving and tightness in the chest because of the vomiting act. So the ibuprofen is one main change that I have converted to over the past several years, which has been fantastic, because now not only do you feel better because it's a better medicine for this particular surgery, but you also can get back to driving and working within 24 hours. There's no problem, there's no limitations because of the narcotics that you're using. So patients love it. And in fact, I've been keeping track of all the different occupations of my patients and how long it takes them to go back, and the vast majority are going back to work within 3 days. And some of them, for example, waitresses and hairdressers, which are two of large segments of my patient population's occupations who use their arms a lot, have an average return to work of 1.5 days, which is amazing, that you could spend a whole day carrying around trays or working cutting hair only 1.5 days after a surgery. But it's true. Now, everyone is not the same. I do need to point out that if you happen to have a long recovery after breast augmentation, it could be because your surgeon doesn't use these techniques. But even with a rapid recovery system, you could still have a 1 week downtime before you can get back to work and feel comfortable, and that's okay. Everyone heals differently, and you got to take it at your own pace. But if you're doing everything you should be doing on the most part, and the surgeon has done already everything that he or she should have done in surgery, you can expect a fairly rapid recovery to return to most of your daily activities and work. Finally, I want to address exercise. Rapid recovery method is you getting back to your normal life quickly, but it does not mean returning to a full exercise routine within 24 hours. In fact, I will instruct my patients not to do any heavy lifting or vigorous exercise, straining of the upper body, or running for at least 1 month. You can go back to the gym and do a little cardio, use a stationary bike, even do some arm exercises, things that can move your upper body with light weight, and stay active and stay healthy. But heavy lifting, bench press, butterflies, running, or anything that causes a lot of bouncing, I will avoid for 4 weeks minimum to make sure that your incision and the pocket inferiorly is fully healed, so that you don't put unnecessary strain on that and cause a complication which we could otherwise have avoided. So hopefully that helps. It's an update to the rapid recovery method as we use it at the Zannis Center. It's been a fantastic tool for patients returning back to work quickly, and happy patients tend to be ones who have minimal pain, minimal downtime, and minimal disruption in their everyday lives. So that's always the goal with every surgery. Unfortunately, I do a lot of breast augmentation surgery. It's one of the main things we do here, and fine-tuning that system has been a key part of improving our overall patient experience with breast implants. So I hope that's been helpful and informative to you. If your surgeon does not necessarily instruct you on these things, ask about it. Always listen to their advice, but ask if potentially you could incorporate some of these strategies at home to give you a smoother, better, happier recovery after breast implants. Thank you very much for joining me today. Thanks for being a part of the Boobdoc Nation. And as always, don't forget to subscribe and hit that notification bell so you don't miss a thing. Take care.